Hi, I'm Paul Hendrix. I'm a spokesperson for the Lung Cancer Foundation of America. I'm sitting here talking with James. Um, James, tell me a little bit about your experience as a spokesperson for the Lung Cancer Foundation.
Yeah, thanks, Paul. As Paul said, I'm James Hiter. I have been working with Lung Cancer Foundation of America now for about 5 years. Soon after my diagnosis, I was really struggling to find information. And frankly, especially when I started chemo, the person who came as kind of I called her my cancer coach, was actually a person who had had breast cancer. And I didn't know anybody that had lung cancer. So I relied on her heavily. She helped me a lot with coaching me through some of the challenges of chemo and that sort of thing. And I reflect back on that now and think how incredibly important and helpful that was to me then. And now the idea of being able to do that same thing for other people, especially people who are newly diagnosed, but with the specificity of and knowledge of lung cancer is really important to me.
Well, that's great. I'm a fairly recent lung cancer survivor, and the whole position of lung cancer advocate or lung cancer spokesperson is new to me. So you're almost like that person helping me to guide me through this process. And I'm going to kind of learn a little bit from you about what advocacy is and um, the benefits that you think you get out of that with Lung Cancer Foundation of America.
Well, I tell people that they should really try and aspire to be a student of the disease. And so when we think about advocacy, you and I are thinking about advocating for others. When I'm talking to somebody who's newly diagnosed, I'm really talking about being an advocate first and foremost for themselves. In order to do that best, it's important for them to educate themselves about the disease. And that's where organizations like LCFA come into play, because the information that's at lcfamerica.org is some of the stuff that I wished I had had when I was first diagnosed. And so really having an avenue for that information for people to be able to get at it and get at it early makes being a student of the disease a lot easier than it was even for me back 7 years ago when I was first diagnosed.
Do you find it a benefit to be able to talk with other cancer survivors and compare um, the journeys and take information from that and pass that on to other cancer?
Yeah, absolutely. I mean, when I was first diagnosed, I thought of a cancer support group as a circle of chairs. My mind, I'm thinking a church basement with a bunch of people just weeping. And I was like, I don't have time for that. That is not what I need right now. What I came to find out, though, is that some of these support groups and other organizations do a lot to connect people that are having a similar experience, and that connection is super helpful. It allows, when you're having, this ride of cancer, lung cancer is like a roller coaster. And so when you're at the tops, you can be that person that helps pull other people up. And when you're at the bottom, other people that are at the top will help pull you up. And that really helps level out the ride a little bit, helps elevate everybody's experience a little bit. And it's super helpful. But being able to connect with people, share experiences, learn from each other, the things that worked, the things that didn't work. Those are all super helpful and a big part of why I continue to be involved in advocacy.
I wanted to ask you about do you have an insight to some of the new technology and new treatment options, being an advocate, that you can also inform other patients?
Yeah, it's almost impossible to stay on top of everything. The developments that are coming in lung cancer research are fast and furious and super exciting and super hope instilling. But by being an advocate, by being kind of keeping your ear to the ground a little bit on the research, it allows me, when I am talking to somebody or an organization, to be able to help them have the hope that I have about what's coming down the pike, the things that are available today that maybe they didn't even know about, or the things that might be available tomorrow that these smart researchers and physicians are working on as far as that goes. But having access to those people, being able to connect with them and to talk with them, that's all a huge part of why I enjoy being an advocate, especially with LCFA.
I have a big passion in advocating for early screenings. That's something that really motivates me to be a part of Lung Cancer Foundation and to help not just people that are just becoming familiar with the disease, but people that wouldn't necessarily know that now's the time for anyone to get screened. Is there anything that you can mention to people in terms of the importance of screenings?
Yeah, I mean, for me personally, I wasn't eligible for screening because I didn't have all of the necessary history that for screening. Mine was caught by accident because I had bronchitis or the flu, and my doc wanted to make sure I didn't have pneumonia. For people that are eligible for screening, though, it's so quick and easy, and knowing is so important because the earlier we find it, the more chances we have to actually cure your lung cancer. But regardless, knowledge is power, and the sooner we have that knowledge, the better. So anybody that's eligible for screening, I would encourage them just to knock it out, go get it done, quick, painless, and yeah, it's super important, and to not have to wait until something starts hurting. Take advantage of the programs that are out there for screening.
Right, I agree. That's great information.
Paul, thanks for having me. This has been a lot of fun. I've really enjoyed it. If anybody is looking for other video content like this, they can go to YouTube and just search for LCFA or LCF America. They'll find a lot more videos like this, helpful for both advocates and for patients.
Fantastic. Thanks, Jim. I appreciate it.